what a wonderful world. I see skies of blue.
Many of Thailand's white sandy beaches stretch for miles and miles along coastlines fringed with coconut trees that sway to the rhythm of the sea. The rare flora and fauna, underwater marine life and corals, with crystal clear water and mangrove-lined creeks, offer a dreamlike view of the rare gifts of nature. Many tourists seeking peace and tranquility have found these places in southern Thailand to be memorable lifetime experiences. That was the situation until the appalling disaster on the 26th of December 2004. The tsunami unleashed giant waves that crashed down on the shores of Thailand at such speed and force that within seconds, whatever was in its way was destroyed. Many of the survivors, the bereaved, the destitute and the orphaned, now all faced a life that has been completely turned upside down. Such a great tragedy will always be remembered. Some of the giant waves reached 10 meters, causing millions of dollars in damage. The human cost was incomparable. 6 provinces in the south came to harm. These included Ranong, Phang Nga, Phuket, Krabi, Trang and Satoon. Amidst the havoc, turmoil and intense horror, there was one positive aspect that will be long remembered: the people's reaction. The compassion for those struck by the tsunami was immense. People from all walks of life and corners of the world came forward to volunteer help. The Department of Health, Ministry of Public Health, was amongst those with outstretched arms, offering help, particularly in sanitation matters. In the immediate aftermath of the disaster, the Department of Health set up task forces to cover the 6 affected provinces. These forces commenced work on the 28th of December, comprising of personnel from the Bangkok headquarters, together with those from the 12 health centres, as well as provincial health personnel. The task forces worked hand in hand with the local communities to restore the victims' quality of life. In order to maximise efficiency, the Department of Health set up 3 disaster management teams as follows. Firstly, a team was attached to the War Room, based at the Ministry of Public Health in Bangkok. This group was in charge of planning, analysing and working to ensure that each operational problem be appropriately handled. Secondly, a rapid response team. This team included both personnel based at the Ministry as well as those based in the affected areas. Thirdly, a team to coordinate and integrate information and provide corrective guidelines from the headquarters to the affected provinces. In helping the tsunami victims, the Department of Health adopted knowledge management methods that included both local techniques as well as modern technology. Consideration was also given to the victims' long-term well-being. Therefore, systems and guidelines were introduced covering 2 important issues, namely 1. The management of environmental sanitation. 2. The promotion of good health and personal hygiene. Because the damage was so complex, the Department of Health divided the areas into 3 categories, namely 1. Tent and temporary shelter. 2. A permanent living centre. 3. The care for corpses and post-mortem examination. The department's action plan defined urgent matters and priority issues. 1. The critical period. 48 hours after the tsunami is when urgent problem solving is required, particularly at the Yan Yao and Bang Muan temples, where corpses are kept and post-mortem examinations are conducted. There, extra care and strict measures were taken not to allow infections to spread. Disinfectants, deodorants and insecticides were used to prevent infection carriers. Simultaneously, provision for safe places, clean food and pure water were also urgently needed. In addition, the Department of Health needed to urgently survey the affected regions in order to assess the scope of damage before planning appropriate measures to be taken. There was a need to publicise and advise people on how to take care of their personal health and hygiene in order to protect themselves from whatever epidemic that may follow. 2. 1 week after the tsunami is the time when numerous other problems are found. This begins with the care of corpses and post-mortem examination areas, which by this time houses a huge number of corpses and hosts a great many visitors. The problem that followed is the tons of waste created by the hundreds of thousands of people who were looking for their missing relatives, friends and loved ones. Contaminated waste of 2,000 kilograms per day had to be carefully and correctly collected and put in red plastic bags before being disposed for incineration. To prevent the spread of infections, insects or germ carriers had to be sprayed with insecticides and disinfectants. The wastewater from post-mortem activities had to be treated. When people gather together in such large numbers, the problems that occur often relate to environmental sanitation, such as the issue of water supply management. Neither was the water pure nor clean enough for the requirement. This is due to the fact that some of the supply sources had been contaminated whilst others were destroyed by the giant waves. The department solved the problem by introducing field chlorination process. Prior to distribution, the quality of the water had to pass the department's special test. Because of a huge donation of drinking water, no one suffered from a shortage of clean, purified water. This helped prevent the spread of any epidemic. The issue of food sanitation. In order for people to receive clean and safe food, the cooking place should be significantly raised above the floor level. The cook should cover their hair with a hat, wear an apron, have a separate washing up area, and must not throw waste food onto the ground. Otherwise, this could be the cause of the breeding and spread of germs. The waste collection system should begin by separating dry waste, such as foam boxes, plastic bags, before they are disposed of into a marked bin or container. There should be plenty of waste bins placed around the area. New hygienic additions of latrines were also required. Mobile latrine units were provided, particularly where there were large gatherings. Keeping the latrines clean was also necessary. As for the draining of wastewater, drain pipes were systematically put in place to prevent puddles and the flooding of living quarters. 3. The rebuilding period begins at around 10 days after the crisis. This is an important juncture for the development of measures for the environment, sanitation and personal hygiene management. This period is the time when problem issues are being collected, most of which needed to be urgently solved, such as by this time, the care of corpses and post-mortem examination areas will have accumulated a great deal more infectious waste, possibly up to 3 tons per day. This requires that proper systems be put in place and sanitation aspects of the environment must be seriously taken into consideration. The wastewater must be tested to prevent the spreading of germs to other water supply resources. At the living centre areas, many houses will be built for the homeless tsunami victims, which, in turn, will create the formation of a community. It is therefore very important that there should be a system for environment sanitation management, including the provision of drinking water by installing large water purification equipment. Water quality tests must also be conducted. Since the commencement of the rebuilding activities, the Department of Health, Ministry of Public Health, has been closely and carefully implementing and monitoring the management of sanitation environment for housing, water, food, refuse disposal and wastewater. Awareness building of the importance of sanitation systems have been repeatedly communicated to the community dwellers. It is our belief that the environment has a direct impact on people's emotions. The Department of Health places much emphasis and effort on food sanitation and the healthcare for children, expectant mothers and elderly people. Our role in improving people's environment sanitation will continue on and on. Beyond this recent tsunami, which has taken so many lives, crushed so many homes and shattered so many hearts. But the tremendous response to this disaster shows that there still is good in the world, and where there is good, there is hope. The gigantic and monstrous waves that has caused so much damage was a natural phenomena we were not able to avoid. Placing aside the tragedy, nature gave us mortals an invaluable lesson. Nature has taught us to obtain knowledge, be better prepared for future disasters, be caring and compassionate, taught us to further develop the officers' capabilities and to educate the public. It magnified the need for both government and non-government organisations to combine their efforts and resources to lay solid and systematic foundations for future disaster-solving processes. It has taught us to better understand nature, that we must learn to respect and nurture and live with nature in harmony. Please accept our very best wishes from all of us at the Department of Health, and welcome to our country.